So, our next session is on emotional support during treatment for you and your carer. And our wonderful speaker is Dr. Toni Lindsay. So, Dr. Toni Lindsay is a clinical and health psychologist who has been working with both adults and adolescents for over a decade. She heads up the Allied Health and Psycho-Oncology Department at the Chris O'Brien Lifehouse Centre in Sydney and is a specialist in the care of adolescents and young adults with cancer. Toni teaches in the Department of Adolescent Medicine at the University of Melbourne and the University of Sydney Nursing Schools. She's also a published author with two books, Cancer, Sex, Drugs and Death, and The Cancer Companion, both focusing on an ACT-based approach to cancer care. Welcome, Toni.
Thank you.
Thank you so much.
I'm very excited to be here.
We're very excited to have you, by the way.
Cool. I'll just pop my screen on. You'd think after many months now of using Zoom, I would be nailing it, but I'm totally not.
Oh, you are, don't worry.
So I guess, as Erica said, my, focus of today is very much around the emotional side of coping with all of this. And I thought, not only as a reflection of the landscape that we're sitting in broadly, but I think as if I think about the things that patients talk to me about most, the thing that comes up over and over and over again is this idea of uncertainty and coping with uncertainty. And so my plan for today is to have a very whistle-stop tour through some of the ways that, in working with patients for a long time, have kind of come up, kind of found that people find helpful in navigating this stuff. So just as a kind of, introduction, and I guess to follow on from the last speaker, just kind of chatting about how do you access services. So psycho-oncology services exist in most big cancer hospitals, or kind of, and sometimes they can look really different. So in our hospital, for instance, there's social workers, psychologists, psychiatry. In other services, it might be just psychologists. In some services, it's just social workers. It depends on the makeup of the service. If you happen to be being treated at a smaller hospital, it might be that these services don't exist in this kind of form, but it's likely that there will be a social worker, a specialist nurse, someone who can kind of help you navigate. So I guess in the same way as Andrea was talking about, often kind of identifying these pathways is kind of the first step, and then often these referrals can happen. We see people along kind of a spectrum of different things, but that stuff is always around the emotional side of this. And more often than not, the patients and family members that I see, it's not that people aren't coping or that they're not managing or something's kind of psychologically really wrong with them. It's more a function of this really unpleasant, terrible, hard to navigate thing has landed in their lives, and that thing is really hard to navigate, rather than it being a kind of space where people aren't coping in the world. We often talk about this idea of resiliency, and patients often come to me saying, I just want to be more resilient. Can you teach me how to do that? And that's a really hard thing to do, partially because it's really hard to actually nail down what this concept of resiliency is and how do you know if you're being resilient. The way that I tend to think about things is often my patients who I would kind of identify as being most resilient is that when difficult things crop up, they can kind of cope and change and manage alongside of those things. It's really common that people struggle with some of these things some of the time, and that's okay. We often talk a lot within cancer care, particularly around this idea of if you're not happy and positive all of the time, that doesn't mean that you're not coping. Many of my patients have said to me, if I could meet that person who came up with this idea that cancer patients need to be positive, I want to punch them in the face. This stuff is really pervasive in our culture, and it's really hard. And it's really hard as a patient or a carer to navigate this because, of course, in the face of these really tricky emotional things, it's ridiculous to think that you would be happy all the time. And I don't know anyone who's happy and positive and optimistic all of the time, right? It's much more appropriate that when difficult things happen, we have an emotional response to them. We find it hard to navigate. We find, ourselves oscillating through sadness or anger or frustration or happiness or whatever kind of emotions turn up. So for me, this idea of resilience is often around, okay, what does it look like to cope regardless of what shows up? And how do we accept these kind of difficult emotions that might be there? So as I mentioned, the biggest thing that I tend to see clinically isn't depression or anxiety, and those things absolutely turn up. But usually underneath those things is this kind of piece around uncertainty. And we as humans don't have much tolerance around this. If you think about how we've evolved, it's never made sense of us to be really, to have to sit in this grey space, because in the past, that grey space was probably the thing that meant you didn't understand whether the tiger was chasing you or not. It makes much more sense to go for our brains to be wired into, is there a tiger? Is there a problem? And so that grey has never been very helpful for us. The problem is that our worlds now look really different. And so particularly in kind of a cancer or lymphoma space, we sit in that uncertainty and that grey much more often, because there's uncertainty kind of inherent in the whole process around the disease itself, around the treatment. How will I cope with this? What's it going to look like? What's going to happen to me? Often lots of uncertainty around the future, around will I relapse? How's this, if it was going to turn up again, how would it turn up? Do I need to be on high alert for that? But also kind of, I guess, some more kind of existential pieces around, now that I've had this experience, my world looks and feels, and I'm engaging in the world differently. So how do I make sense of that? What's that uncertainty piece that comes alongside of that? And then, as I kind of alluded to, the whole world's living in this space of uncertainty at the moment, right? We can't plan, I guess, depending where in the country you are, we can't plan much more than a couple of days in advance, because we kind of don't know what's going to happen. And so I think when you layer those two things together, that uncertainty is very real and very present in our lives. Interestingly, I feel like if I think back through the last 18 months, my patients have probably coped a whole lot better with the uncertainty than the world at large. And people that I bump into, including health professionals who do not tolerate this stuff at all. Because you guys, in lots of ways, have been primed for it. It's kind of like, okay, I can sit with that discomfort that comes from not necessarily knowing an answer. And for anyone who's been on treatment or kind of had relapses or other things, this is a really familiar space, right? If I think about people with, say, follicular lymphomas or myelomas or things like that, the kind of that knowledge of the disease being present in your world, but kind of in an uncertain way, is really there in front of center for most people. As I alluded to, we're not meant to get rid of this stuff. And in fact, if I have patients turn up who aren't connected with this stuff, then I'm much more worried. The patient that turns up and says, I'll be fine, I don't need to worry about it, that causes considerably more anxiety for me as a clinician than it does if somebody turns up and says, I'm really struggling with this, I'm feeling anxious, I'm feeling worried, I don't know what to do with myself, I can't make sense of this thing. I often think about the reverse of this. We're pretty quick to come down on ourselves and go, I should be coping better. But I often kind of ask people to flip that in the other direction and say, well, what would it mean if you weren't having this response? If I just told you you've got a life-threatening or potentially life-threatening illness and you sat there and didn't have any response, what would that say? That's a really strange thing. But we kind of get disconnected from that, because often the sensation of this stuff turning up is really unpleasant and really hard to manage. I was talking to someone a little while ago and I was asking them how they were, and I think this has just encapsulated it really nicely, where they're like, I'm okay until I'm not. And I think that's often both in a pandemic sense, in a carer sense, but also in a patient sense. I think that probably encapsulates lots of our lived experience of this stuff, right? Things are all right, but then something will change. And I think uncertainty generally, there will be times when it's really present and there might be times when it's more absent, but knowing that will kind of ebb and flow. So we often see that when patients have been on a particular treatment for a while, they might change off it, they might go off treatment, they might enter into that period of kind of surveillance scans and things. That's often the time when the uncertainty will kind of pick up a bit more, when that shifts and changes. There isn't a magical solution to get rid of this stuff. For some people, it turns up in a really kind of, I guess, psychological way, in the sense that it's around anxiety or needing to feel like they're in control. For other people, it will be a really physical experience. You know, they might not sleep. They might feel kind of that their heart's racing all the time. It might be just not feeling right in their body. But more often than not, it's a combination of both. Sometimes people can't necessarily identify what's happening in the headspace, but there'll invariably be stuff going on. So all of this up until now has been very much me saying, well, you can't do anything about it. We can't get rid of it. But what we can do is kind of a series of things that help make it more manageable. And I'm going to talk about these things in a fairly easy sense. Part of that's because this is what I talk about all day, every day. But also because they're concepts that theoretically are quite easy. When it comes to putting these into practice in our own lives, it can be hard and tricky. And so I always think about this stuff a little bit like, if you had never played tennis before and somebody says to you, hey, I want you to come and play on centre court at Wimbledon, it's probably going to be a disaster. Well, particularly the way that I have attempted to play tennis in the past. But what looks different is, even if you get a bit of practice in, or you kind of bump into this stuff occasionally, you might not be the world #1 tennis player, but it will be better than not doing anything. And so I would encourage you to kind of come at these things with a bit of curiosity and a bit of interest about, okay, how might I try that? Or how might I give it some space? Our brains are really clever. So probably lots of you listening right now, the thing that's coming to your head might be, no, I can't do that. That's ridiculous. What's she talking about? So I just want you to all kind of do a bit of a thought experiment with me and kind of clock that if that's happening. You know, just notice what your brain's kind of coming up with. So what I'm going to do is kind of go through these like I said, it's a very abridged version of what you would do if you were doing these kind of one at a time. But it's more just to give you guys a bit of an overview of how we think about this stuff. So the first stage is about acceptance. Now, acceptance is one of those things that people talk about really flippantly. The way that I'm talking about acceptance is, it's not about something being good or bad. We often talk about acceptance, or it's kind of in that popular culture thing of, if I'm going to accept something, that means that I have to be okay with something that is inherently terrible and I just need to kind of suck it up. That's not what I'm talking about at all. What I'm talking about is almost a kind of process of going, okay, I see this thing that's turned up in my life. I don't need to like it. I don't need to engage with it. I don't need to kind of try and get rid of it. I just need to know that it's there and it will probably turn up, and that's okay. And that can be kind of about uncertainty. That can be around anxiety. It can be around a million things, and we're going to talk about it in a second. But I think, you know, the thing that I would like people to kind of think about with this is, okay, I need to make some space and some room and be open to the idea that difficult things will turn up and it's okay. Again, I say this is one of those things, easy to say, much harder to do. But with practice, you can kind of make sense of this stuff. So I just thought this is a really nice example of kind of the difference between how our brains think about this thing and how I guess I would be keen for us to think about acceptance. So it's raining. I don't like the rain. I wish I wasn't raining. My day would be better if it wasn't raining. My day is ruined. Every day is like this. It's always like this. Why does it always rain when all I want it to be is sunny? And that's, you know, and we all have that kind of voice in our head, right? You know, if something's not going okay, this turns up with pain, it turns up with nausea, it turns up with chemo symptoms, side effects rather. You know, this stuff turns up for us all the time. If you come at this from an acceptance kind of perspective, it's raining. Yep. There's no emotion attached to it. It's just what it is. So I like to think of it, there's a few kind of hopefully entertaining cartoons. Some of them may be slightly in poor color, but we'll get to that. So like I said, main part of this is kind of accepting that it's going to turn up. So if we think about our little dinosaur, stage one is acknowledging that dinosaur. It's like, oh, there you are. I see you. I see you anxiety. I see you uncertainty. I see you struggle that I'm having with that thing, whatever that thing is. I see that piece that turns up every time I go to chemo and I don't want to do it. This idea of allowing that discomfort, that difficult thing to be there and to not be fighting against it and to make space for it, you know, allowing that thing to be part of your world. You know, I think if I said to everybody in the audience, I could get rid of your lymphoma, your or whatever kind of illness you have, I can get rid of that tomorrow. Everyone would be lining up to say, yeah, but that's not the way the world works. And so making space for that and going, okay, of course I've got to sit with this, you know, this discomfort around having this thing in my life. Well, what do I do with that? So the first thing not to do is to fight against it. And that's how we manage most of our uncomfortable emotions, right? You know, if something kind of turns up in our mind that we don't like, we'll often say, oh, I need to stop that. I need to get out of it. You know, this turns up with anxiety and depression all the time. You know, people might be having difficult thoughts or difficult emotions. And the response is, I need to stop it. I need to do anything I can not to do it. I'll avoid it. I'll keep myself busy. I'll keep myself distracted. You know, this idea of the tug of war is really interesting. I don't know how many of you remember doing tug of war when you're at school. I don't know whether they still do it. I remember doing it and not liking it as a child. But, you know, that idea when we're in a tug of war, our instinct is I'm going to hold on to this rope as tight as I can and pull as hard as I can, and that's how I win. But everybody knows that the way that you win the tug of war often is to drop the rope, because then the other team falls over and you're kind of left standing with the victory. If you think about on the other side of that tug of war, you've got the anxiety, the uncertainty, the worry, the whatever. Every time that you're in that fight and in that struggle, it's taking energy. And most of the patients I bump into don't have loads of energy, right? Like you're using lots of your capacity just to get through the day on treatment, dealing with life, dealing with, you know, kids and families and jobs and stuff. And so sometimes that thing that we are drawn to do, which is to continuously fight against our emotions, sometimes the thing to kind of sit back and go, okay, I'm just going to let that be there. And I'm not going to fight with it. I'm not going to try and get rid of it. I'm not going to kind of be in this tug of war or this struggle with it, but it's there. And then we kind of come back to that acceptance piece, right? Of like, I'm going to let this thing have space. One of the most effective things that anyone can do with stuff that's happening emotionally is to actually get out of our heads. Most of the time, the things that we're struggling with live in the future. So all of that uncertainty, anxiety, worry, most of it's about what's going to happen next. And so giving yourself permission to go, okay, I need to come back to the here and now, because right here and right now, I'm okay. None of those things I'm worrying about have happened yet. And you know, the reality is, and you know, I challenge you guys to think about this in terms of your own experience. When you were first diagnosed, if I had have said to you 6 months before that, you're going to have this thing happen in your life, everyone would have said, oh my God, I'd never cope with that. That would be horrendous. But you know what? When it happens, you get on and you cope with it. And all of those worries and things we have about the future, the exact same thing will happen. You know, if one of those things that you maybe have predicted, and we all know that our worry is not very predictive, you know, for most of you, I can't imagine that you'd worried about the cancer turning up, and yet it has. But you probably worried about a million other things that didn't show up. And so knowing that that worry is probably not predictive anyway, but kind of there's a bit of reassurance of going, well, if that stuff does turn up, I'll kind of just get on and cope. But the piece of this is in the present, we're okay. We can make decisions right here and right now for things that will help. And one of those decisions is often going, okay, I'm getting caught up in my thoughts. I need to come back to the here and now. And you can do this in a million ways. Anyone who's done any meditation stuff knows how this stuff works. I don't even think you need to meditate. Sometimes this can be as simple as, you know, if you're laying in bed thinking about this stuff in the middle of the night, just like moving your toes up and down and noticing what that feels like on the blanket. Or it might be focusing on your breathing. It might be, you know, one of my favorite things to do when I'm kind of caught in my head is to try and find, you know, 5 things I can hear. And the first couple are really easy, but then you have to really pay attention to catch the last ones. You know, so things like that that just bring you to the present. It might be when you're out on a walk and you notice yourself kind of thinking, going, oh, there's that bird in that tree. I'm just going to stand here and watch that bird for a second. You know, particularly at the moment, because all of the animals are out doing kind of ridiculous things and they're all very cute. That stuff is the stuff that just kind of takes us out of that thought. And often we know that that thought's not particularly helpful. Like I alluded to with the acceptance piece, a huge part of this is actually naming it, noticing it when it shows up. So if you're kind of noticing, oh, anxiety's turning up, kind of actually giving it a name. And you can call it anxiety, you can call it Fred, you can call it whatever you want, right? But it's noticing. So it's like, oh, Fred, there you are. Yep, you've turned up again. Oh, you always turn up the day of chemo. Or you always turn up when I know my partner's going for scans and I'm really nervous. You know, kind of giving that thing a name. Often my patients will kind of picture it as, like, it sounds a bit strange, but we often picture these things as cartoons, right? And often that kind of like guy on either shoulder. So sometimes you might have anxiety, you might have uncertainty, you might have, you know, sadness or happiness or whatever. And they all kind of show up as these little characters. So thinking about what your character looks like, you know, when Fred the anxiety shows up, what's Fred look like? You know, and kind of giving it a presence. This works for a few ways. One is that it gets it out of your head a bit, but it also puts a bit of a space between that stuff that's happening in our head and us noticing it. Because when stuff happens in our head, we believe it to be true. Whereas once we put a bit of space and distance in there, it just gives us a bit more capacity to deal with it. So our brain can go, oh, that's anxiety. Whereas when it's happening in our head, we often don't clock it as anxiety. We just clock it as that thing that's happening and it must be true. I mentioned before that the present focus stuff is one of the most helpful things. This is probably the second most helpful thing. In the landscape that most of you will be sitting in, uncertainty, anxiety, worry, that stuff is going to turn up, right? So if we kind of think about this landscape, you've got a choice in this. You can sit in that landscape and wait for that landscape to pass, for everything to be okay. And I've met patients who do this, right? You know, they wait to their 5 years for their scans before they make any big decisions. That's fine. That's one way of doing it. The way that tends to work better is to go, okay, in this landscape, I know this stuff's going to turn up and that's okay. But what I am going to do is I'm going to make sure I'm doing the stuff that's important to me, regardless of those things. So you can see that this guy's carrying his little balloons and it's got self-doubt and uncertainty and anxiety. We will absolutely carry those things with us, right? You know, and that's probably separate to the cancer piece or not. But if you're doing the stuff that's important to you, it's much easier to manage this. You know, and that stuff that might be important is going to be different from person to person. It might be family stuff. It might be work stuff. It might be community-based things. It might be leisure. It kind of doesn't matter. The thing that's important is I'm doing this thing that's helping me move my life in the direction that I want to go. And these can be really small things, right? Like, you know, it might be having big relationships or kind of making sure that you're connecting with all of these people in your world. Or it might be stuff like, you know what, I haven't called blah, blah for a while. I might just give them a text. You know, it doesn't need to be huge stuff. And in fact, while you're on treatment particularly, I would say don't make it huge stuff. Make it really small, manageable bits. But stuff that every day you feel like, you know what, I've done something that's important to me. And the piece that's often really hard for us as humans to get our heads around, we are awesome at being kind and compassionate to other people. You know, we see people in our world struggling. We look at them, we go, oh, geez, they're being tough on themselves. They're doing so well. They're coping so well. If I was coping with that, I wouldn't be coping with it at all, kind of thing. but we rarely can turn that to ourselves. So what I would encourage you to do, and I encourage most of my patients to do, is look at that landscape of how can I be kind to myself in this? And that might be about things that you do, but equally as much, it's about saying to yourself, you know what, you're doing okay. This is tough. This is a really hard space to sit in, and I'm doing as well as I can be. Even if things don't feel like they're going well, you're not actively doing things to make it worse. You're trying to make it better. And so sometimes we find ourselves sitting in these spaces where it is just hard and there's no necessarily, there's no kind of solution to that, but actually being kind to yourself and going, you know what, I'm doing okay. I'm sitting in this as well as I can, and that's really tough. So some quick questions about how do you check in with yourself? So I use lots of kids-based stuff with my adult patients, mostly because it's just easier to access, right? Like adult stuff is often like complex and messy. And so, this is equally true of things like meditation. If you're trying to meditate, I would recommend you do kids ones because they're quite immersive. They're really visual. They're just easier to follow. Whereas sometimes adult ones will be things like, focusing on your breathing, which if you can do that, great. But most people find that doing the kids ones is just more fun. So I went looking for some questions around this stuff, and the Kids Helpline have loads of nice resources. But I just thought these are really nice questions that you can kind of think about to help kind of connect with where you are. So things like, what can I do to help myself get back on track, whatever that looks like for you? We know that you can't control everything. You can't control the uncertainty. You can't control the disease, but there is a bunch of stuff that will be in your control. What can you do? I often talk to my patients about this idea of you've got 3 choices. You can leave this situation. So often in cancer land, that's about, I'm not having any more treatment. I've had enough. I'm out. Most people don't take that path. I can stay and try and make this better. So I can do the things that are going to help bolster me, which might be, even though I don't feel like it, I'm going to go for a walk in the sunshine. Or I can stay and make it worse. And usually in this space, it's I'm going to take to my bed, I'm going to shut down, I'm not going to connect with people. That stuff might feel better for a day, rarely feels better for a week, and it almost never feels better for a month. So I think kind of thinking about, okay, if I'm going to stay in this space, how do I make it better? How do I do things that are going to help me move forward and move towards the values, the important stuff that I want to do, rather than getting stuck in how terrible things feel? And I think that question that Andrea kind of alluded to earlier, who can help me in this? And we're going to talk a little bit in a sec about how you kind of connect with those things. But I think kind of thinking about, sometimes it is really hard to do this stuff by yourself. Can you have those difficult conversations with your family, your friends, your people to say, I'm struggling, I need some help? Are there, if you don't want to have those conversations with those people, can you have them with your doctor, your GP, your psychologist, your whoever? I often put a question to my patients around what are the things that are turning up reliably, because we're pretty predictable as human beings. So if you can kind of get a good handle on what are you struggling with, what are the needs that you feel that you're not getting met, how do you manage when stuff is difficult? Because if you can connect with that stuff, it probably helps you get a sense of what's going to happen next time things are difficult. And, I often think about this in terms of chemo cycles, right? Like the first chemo cycle, no one's got any idea what's going on and everyone's really anxious and overwhelmed and terrified. By the second and third, though, it's kind of like, okay, cool. I know I'm going to look like this on this day. I'll do this thing on that day. This will look like this. So then that thing that was this real unknown becomes more predictable. So you can use that in an emotional sense as well. If you know in the lead up to your scans every time for those 2 weeks, you get really anxious, then I think, thinking back to it's like, oh, that's that scan anxiety. Oh, you've turned up. Of course you turn up. You turn up every time. Okay, what can I do to manage you? So it doesn't get rid of the things, but it means that those things, when they turn up, feel a lot more manageable. So there are a million people in your world that can be helpful. You just have to navigate them. But most importantly, you have to reach out. unless you say that you're not okay, people don't know. And this is often a really interesting thing that happens in my kind of line of work, right? Like, I'll often meet someone and they'll get really frustrated that everyone in their world isn't doing what they need them to do. Might be that they've finished treatment, but people are assuming everything's back to normal. So they've stopped dropping off the casseroles or stopped doing whatever. But then when we talk about it, often that person will say, well, I only let them see me when I'm really well. And, I don't tell them what's going on, and I don't tell them I'm scared about this thing. And it's kind of like, well, then they're not going to know, right? Because you're putting on your best front to be like, no, everything's fine here. So people go, oh, everything must be fine here. So I think thinking about, how do you communicate with the people in your world? And that's equally true for if you're a carer or if you're a patient. And often for carers, this stuff is even less visible than for patients. Patients often have physical stuff going on that people kind of go, oh, I need to do something, whereas carers often don't. So I think kind of recognizing for yourself, when am I not doing okay, or when do I need some extra help? But also thinking about, how do I name that with people? And like I said, there are heaps of people at your disposal. GPs are a good person, the clinical team, it might be a nurse or a doctor or the person who takes your blood, or, there's heaps of people that they might not be able to help you. But if you kind of have that conversation with them because you trust them, they can probably link you up with someone that can help you. If you're hospital based, sometimes this stuff is a bit easier to navigate because the services are right there. But as Andrew was saying, there is a million community resources. The Lymphoma Association, Leukemia Foundation, looking at things like Cancer Council, there's local charities around. There is heaps and heaps of stuff out there. And sometimes it's just a bit of a Google to find out where to go first. So any questions? I would encourage you not to ask me really in-depth, emotional, personal questions, given that there's 140 people listening and it's probably not appropriate to ask in 5 minutes. But other than that, I'm open to questions.
I think that's a very good point, Toni.
I've been caught out with this before when people disclose something and I'm like, oh, okay, that was not what I thought was coming in the question section.
Oh, no, fair enough. I've asked everyone to ensure that they're popping their questions down in the question function in the chat group. So I really loved your advice about naming your feelings as well too. I think that that's something that we so often take for granted as well too. I think that that's so important. I think I need to take your advice on board as well too.
Yeah, look, it's been quite interesting, I think. As I was kind of saying, like, I think in the midst of all of this pandemic stuff, we've had to get, like, we as a society have had to get really, really comfortable with some of this discomfort, right? And there's lots of people I'm talking to who, a bit like what happens when people are diagnosed, all of the kind of content gets stripped out of their world. And so then they're just left sitting with this kind of discomfort and unease. And so naming that and giving that kind of language is really helpful.
I think that's very true. And like you say, no better time than all of this. People are commenting and saying, yeah, such a double whammy at the moment, particularly with a cancer diagnosis and also COVID on top. So I think it's very uncharted territory for everyone.
Absolutely. I feel like this is one of those things that we're going to look back and go, wowzers, how did we get through that? That was really intense. But, like we were saying, right, we're just in it and we're doing it in the same way that you guys turn up, you do your treatment, you go through the process. It's often when you get to the other end, it's then kind of being able to reflect back and go, wow, I actually did really well to get through that as well as I did.
Yeah, and I think that that's it. I think people have to give themselves some credit as well too, because they are doing this, they are getting through it as well too, and it's recognizing that. One of the questions that's come through is someone has said it's difficult to access professional counselling, particularly in regional areas, long wait lists, particularly via counselling with mental health plans. Can you suggest any supports, i.e. phone counselling?
Yeah, definitely. And absolutely, I very much appreciate that in smaller communities, this stuff is really hard, not only to access services, but to access services of people who don't know you. So COVID has caused lots of problems, but one of the things that I think has been really helpful is telehealth, and I suspect telehealth will continue. So now you've actually got access to all of those services. Definitely, I'm not sure about in other states. In New South Wales, through the Cancer Council, there is a cancer counselling service. I can never remember exactly what they're called, but I think it's that, that you can access. There is also lots of practices who do cancer related work who will offer telehealth because of the landscape that we're sitting in. I've also noticed recently there's a bunch of psychology providers that are popping up who are just doing telehealth services. So I think actually that world is going to shift quite a lot, and it will get easier to access those services. And I think probably even from a hospital-based perspective, I think I've got a cohort of patients I've never actually been in a room with that I've been seeing for a year now because telehealth just kind of works for us. So I think that stuff will shift.
Yeah, I agree. And I think as Zoom has become more and more normalized as well too, I think telehealth is the way of the future for a lot of these support services. And I think as you say, it will continue to develop more and more. There's lots of shout outs coming through to chat to you as well
that's
too.
Nice.
People are saying Chris O'Brien Lifehouse is the way to go.
That's awesome. That's always a nice kind of smiling thing in the on a Wednesday afternoon. So I'll absolutely take that. Thank you.
A little bit of camaraderie there for you. So Robin said, thank you for your talk. She especially wanted to point out as well too that naming the unhealthy notion that cancer patients need to be positive all the time. Yeah. I think that's really important. I can't be positive all the time. I don't expect. No. Yeah, it's not reasonable. It's not a reasonable expectation at all.
No, and it puts so much pressure on you, as I say, you as a patient. You as a patient at a time when actually it's really reasonable not to be feeling really positive and optimistic. And I think often my patients can reconcile that, but the people around them can't. And so what tends to happen is, a patient will say to someone, I'm really struggling. And the response that they get back is, no, don't think like that. You just be positive and everything will be fine. And so I think actually if that's the response you're getting for yourself, being able to step outside of that a little bit and kind of go, you know what, I am doing okay. It's okay that I'm struggling because this is hard. So I think, there is a huge piece of pressure that comes with that. And like I said, if I could have a chat with the person that came up with that notion.
The things that you would say, right?
Oh, totally. The same as the person that came up with the cancer is a battle kind of war metaphor kind of rubbish. Yeah.
I don't think any other questions are coming through at the moment. Everyone's just very keen and saying thank you so much. So I think with that in mind, then we might wrap up Toni's session. But thank you so much for your time, Toni. I really appreciate it, and I think it was really vital to recognise a lot of the things that you've said as well too for our patient population.
Awesome, thank you so much, and it's very much a pleasure to have been invited and to chat with you guys today.
Thank you. We appreciate your time.
Thanks, guys. See you. Have a good afternoon.
Thanks, Toni. Bye.
Bye.